a new record in Oregon for the most COVID-19 cases in a single day. The health authority reported over 3,200 cases today and 20 new deaths. That surpasses the previous record by more than 200 cases. Meanwhile, Oregon has nearly 1,100 COVID patients in the hospital. That's an increase of 13 from yesterday. The latest modeling from the health authority shows that by Labor Day, Oregon could see 165 hospitalizations per day. Medical crisis teams will soon be helping out in hospitals all across the state. The governor made the announcement earlier this week, saying that up to 500 medical personnel will deploy to central and southern Oregon and long-term care facilities as well, all around the state. Tonight, we're getting some insight into what Asante hospitals are facing in southern Oregon. Fox 12's Bridget Chavez has the story all new at 6.
Asante hospitals are now over capacity, meaning they have no beds left. The emergency preparedness manager there tells me these medical crisis teams can't come soon enough.
The situation is quite dire. We are dealing with a big surge of COVID patients, and we have surged into and filled our ICU and expanded our ICU. So we are seeing a significant number of COVID patients through our system.
Jackie De Silva is the emergency preparedness manager for Asante, which runs hospitals in Ashland, Grants Pass, and Medford. She tells me they're at a point where they have to board patients in the emergency room. Plus, they've had to turn some transfers from other facilities away because they just don't have the beds.
So these crisis teams that are coming in to help us are going to be exponentially helpful. We have been asking for clinical support to help to provide the care for the community that we need to provide.
De Silva says they expect about 100 medical personnel from Jogan Health Solutions, a medical staffing company the state has contracted with to help with the COVID-19 surge. Asante also has help from 75 National Guard members and 10 paramedics provided by FEMA. But even with this much-needed help, the hospital still has hundreds of positions they need to fill.
To add to that problem, we have 700 open positions across Asante right now. And so as you can see, we have clinical openings, we have non-clinical openings, we're short-staffed, we're dealing with really bad nurse to patient ratios where nurses are caring for more patients than they normally would on a given day, which makes things dangerous.
De Silva says they're doing the best they can, but she worries about the next couple of weeks, especially if cases and hospitalizations continue to spike.
The nurses that work on the front lines are really doing the best that they can. They're working as hard as they can. It breaks our hearts every single day to sit and have the conversations that we have to have.
Asante has already started converting some of its other areas into ICU units, like its cardiovascular recovery unit, and that's where those medical teams will start help caring for patients there. Bridget Chavez, Fox 12 Oregon.